The intent of this lesson is to become familiar with the types of clasps used in removable partial dentures. Specific objectives are listed above. The removable partial denture can be retained in a variety of ways under the category of direct retainers. The diagram above shows that the direct retainer is a primary means of retention for the partial denture. Secondary forms of direct retention come from frictional components, intimate adaptation to soft tissue, and gravity. Primary direct retention can consist of a variety of attachments, which may be placed in abutments either intracoronally or extracoronally. We are primarily interested in the study of extracoronal clasp assemblies. First, think of the tooth as being divided into three sections. The occlusal surface, or lingual, in the case of anterior teeth, provides support. That is, resistance to downward vertical displacement. The middle third is used to provide resistance to lateral displacement, that is, stability. The gingival third provides the location for the actual retentive portion of the clasp assembly. So, one should be able to discern the function of the component by its location on the abutment. The location and functions of components can be better understood using the analogy of a fence post. The slide shows the components of a clasp assembly. The clasp assembly consists of a rest, reciprocal and retention components, a proximal plate adjacent to the guiding plane, and a proximal plate minor connector, which attaches the proximal plate to the framework.
The clasp functions to retain the RPD by flexure of the retentive clasp over the height of contour into the undercut present in the gingival third of the tooth. The tooth is prevented from moving laterally by the action of the reciprocal component on the side opposite the retentive clasp. Once seated, the retentive clasp engages the undercut passively, until a dislodging force acts on the prosthesis. Resistance to flexure of the clasp tip prevents dislodgement of the RPD. This table shows the requirements for an acceptable clasp assembly. The requirements are that the clasp assembly provides vertical support, retention, reciprocation bracing, and when fully engaged, should be passive, exerting no force on the tooth. The clasp assembly should provide encirclement of the tooth greater than 180 degrees, to prevent movement of the tooth. The selection of the clasp assembly first depends on the nature of support for the RPD. In tooth tissue supported RPD, care must be exerted to be informed of the lever systems operating, and to provide appropriate stress relief. As always, we are guided by the principle of minimal tooth coverage. The location and amount of undercut are considerations, as well as the need to apply bracing components. A crucial factor involves the anatomy of the surrounding tissue, such as severe soft tissue undercuts or bony exostoses. Occlusion with opposing teeth must always be checked. Aesthetics is often a limiting factor in clasp utilization. Very high expectations can rule out the use of clasps. One should also consider the design of any existing partial denture. They can be very useful in deciding what works and what does not.
In the extension base case, one can be guided by the location of the undercut in relation to the edentulous ridge. If the undercut is on the side of the tooth away from the edentulous area, the rod wire or I-bar is indicated. If the undercut is on the side adjacent to the edentulous area, then a mod T or embrasure clasp may be used. The diagram on the right illustrates this selection in the distal extension base scenario. The diagram is intended to illustrate how the clasp assembly is guided into the correct position. The amount of retention is determined by the depth of the undercut, the angle of cervical gingival convergence and mechanical properties of the clasp, such as flexibility. In this example, the undercuts are equivalent, but the one on the left is more retentive, because the path of dislodgement is steeper. it has a greater angle of convergence. The retentive component should be the only flexible component of the RPD. The flexibility is determined by a variety or combination of factors as noted above. Wrought wire clasps are always drawn in red, whereas cast clasps are drawn in blue. Of the round and half-round clasps, which has better flexural characteristics? How about length of the clasp? Thickness? Taper?
Clasps may be categorized in a number of ways, generally descriptive of some property of the clasp. The top illustration is of a cast circumferential clasp, as part of an embrasure clasp assembly. The lower is of a cast I-bar clasp, as part of an RPI clasp assembly. The arrow is pointing to the proximal plate minor connector. Circumferential clasps are very common. They approach the undercut from the occlusal and are therefore suprabulge. They can sometimes interfere with closure of the mandible in cases of tooth overlap. They are also not very aesthetic. Being cast, and of a half-round cross-sectional geometry, their flexure is limited. They cannot truly be adjusted due to their cast nature. Normally this clasp is used only when the retentive tip disengages, when the patient closes, or in cases of the all-tooth-borne RPD. If adjacent to a tissue-supported area, it may employ a round cross-section design. This allows flexure in all planes, whereas the half-round design flexes in only the horizontal plane.
The table illustrates a variety of suprabulge clasps, with their various characteristics. Note also the material of which the clasp is made, and how much undercut the clasp is designed to engage.
Bar-type clasps are illustrated in this diagram. Unfortunately, there are some significant contraindications to the use of this type clasp. Because the clasp invades the vestibular space, undercuts, exostoses, and frenal attachments limit its use. Excessive gingival convergence prohibits its use, as it creates a large space that would be unhygienic.
The diagram illustrates two main types of bar clasps: the I-bar, and the modified T. The mod T is used when the tooth undercut is on the side adjacent to the extension base. The diagram indicates the direction of movement of the RPI clasp with closure. The clasp is designed to apply minimal stress to the abutment.
Factors to consider when selecting a clasp. First, identify the fulcrum, if it is present. Determine the location of the undercuts. Determine the direction of movement of the proposed retentive tip and function. In every case, closely examine the patient's occlusion and anatomy from properly mounted and surveyed diagnostic casts. Other considerations. Only the terminal one-third of the retentive tip engages the undercut. The tip is located in the occlusal portion of the gingival one-third of the tooth. Non-retentive portions of circumferential clasp arms should be located at the junction of the middle and gingival one-third. The bracing clasp is thicker,